Hi everyone, this is my friend Sarah, and for my demonstration speech, I'm going to be showing you how to take blood pressure. You need two important things, the blood pressure cuff and a stethoscope.
And a patient.
Also, and a patient, yes. Attached to the cuff are the balloon, which is right here, and the meter. All of these things are going to work together, and taking blood pressure is actually fairly simple. The first thing you want to do is have an arm that has no layers on it, so short sleeves or sleeves that can be rolled up are always preferable. And you want your arm to be laying on a flat surface, which Sarah's arm's on the chair. You just don't see the rest of her hand. The cuff needs to be wrapped around the arm, but not super tight, because when you use the balloon, you don't want to cut off circulation in your patient's arm. That would be a big problem. So you want to make sure that you're able to stick your fingers down the cuff, and then this way you know that it's tight, but not too tight. You don't want to be able to stick your whole hand on the cuff though, because then it's too loose. You want to hang your meter on your cuff so that it's out of your way and doesn't interfere with anything. You also want to keep your meter and your balloon separated from each other, because they can also interfere, as well as keeping your meter away from your stethoscope, because the magnet in the stethoscope can actually interfere with the meter and make it not work anymore. It's all about the magnetics in each thing. Once your cuff is around your patient's arm, you put your stethoscope on your ears, and you take the bottom of the stethoscope and slide it underneath the bottom of the blood pressure cuff. You use the balloon to pump the meter all the way up to 180 degrees. Once at 180 degrees, you use the knob on the balloon to slightly let the air out slowly, listening very carefully for the first and second times you hear the heartbeat. Once you've heard the last heartbeat, you can let all of the air out and remove your stethoscope. For Sarah, her numbers this time were 120/60, which is actually a normal range and means that she's doing very well blood pressure-wise. She's married and has a cat, so her blood pressure can be all over the scale. It's good to know my friend's in good health. As long as your numbers are within good range, you have nothing to worry about. But if they're too close together or really far apart, or very low, you should see a physician immediately or double check if you have no prior history of high blood pressure or of low blood pressure running through your family. That's about it. Once done, you can remove your meter from your cuff and release your cuff off your patient's arm. Thanks for watching, and I hope you learned a great deal. Enjoy!